Welcome to Health Facts with Dr. Danesh. In this video, we're going to find out the effects of low serum vitamin D in COVID-19 test positivity and what is the best course of action for us as individuals who care about their health and well-being when we are at risk or need treatment for COVID-19 infection. In my past videos about vitamin D and D3, we have seen the positive effect of vitamin D and D3 in prevention and treatment of COVID-19 pandemic. In this study published in July 15, 2020, as mentioned before, immunologic effects of vitamin D on human health and disease, it says that the association between low levels of serum 25-hydroxyvitamin D and increased risk of developing several immune-related disease and disorders, including psoriasis, type 1 diabetes, multiple sclerosis, rheumatoid arthritis, tuberculosis, sepsis, respiratory infection, and COVID-19 has been observed. And then it says it is advisable to increase vitamin D intake and have sensible sunlight exposure to maintain serum 25-hydroxyvitamin D at least 30 nanogram per ml, which is 75 nanomole per liter, and preferably at 40 to 60 nanogram per milliliter, which is 100 to 150 nanomole per liter, to achieve the optimal overall health benefits of vitamin D. Here is a summary of causes of vitamin D deficiency and associated diseases with vitamin D deficiency. As you can see, sunscreen, melanin, high latitude, winter, air pollution are some of the causes that you can't get vitamin D from the sun. Medication supplements such as anti-epileptic, the anti-AIDS drugs, corticosteroid, rifampin, and even sanjamwort, which is an herb, could actually prevent from vitamin D absorption. Liver failure, renal failure, nephrotic syndrome, which is part of the kidney disease, obesity, GI disease such as intestinal malabsorption, IBD, cystic fibrosis, celiac disease, bile insufficiency, gastric bypass surgery, cholestyramine, and olestra. Associated disease such as neuropsychiatric disease, schizophrenia, major depression disorder, neurodegenerative disorders. These are all disorders that are associated with vitamin D deficiency. Some infections such as respiratory infections, COVID-19, sepsis, tuberculosis, and hypertension, cardiovascular disease, type 2 diabetes mellitus, and muscle pain, proximal muscle weakness, rickets in kids, osteomalacia, osteoporosis, osteoarthritis, some skin diseases, even allergic diseases and autoimmune diseases, and cancers are associated with vitamin D deficiency. Then they have a recommended dosage for vitamin D intake in individuals who are at risk for vitamin D deficiency and in treatment for patients with vitamin D deficiency. As you can see, in more than 18 years old, something between 1500 to 2000 IU, and then the upper limit for this group of patients are 10,000 IU, which is international unit of vitamin D in individuals with who are at risk for vitamin D deficiency. And for treatment, they have to get 6,000 international unit per day or 50,000 international unit per week of vitamin D2 or D3 for 8 weeks. As you can see, to achieve serum 25-hydroxy vitamin D more than 30 nanogram per milliliter, which is optimal. Then we have this study published in JAMA Network, which is Journal of American Medical Association, on September 3rd, 2020, which is trying to answer this question. Is vitamin D status reflecting vitamin D levels and treatment associated with test results for coronavirus disease 2019? And the finding says that in this cohort study of 489 patients who had a vitamin D level measured in the year before COVID-19 testing, the relative risk for testing positive for COVID-19 was 1.77 times greater for patients with likely deficient vitamin D status compared with patients with likely sufficient vitamin D status, a difference that was statistically significant. In other words, patients with lower serum level of vitamin D have a 1.77 times greater risk of testing positive for COVID-19 as opposed to patients with sufficient serum vitamin D. As you can see, 95% confidence interval is between 1.12 to 2.81, which doesn't contain the number 1, and the p-value is 0.02, which means this study is statistically reliable. And it explains that COVID-19 is more prevalent among African American individuals, persons living in northern cities in the late winter, older adults, nursing home residents, and healthcare workers, populations who all have increased risk of vitamin D deficiency. So the question here is why any governments all over the world are not pursuing vitamin D supplementation for patients who are at risk or patients who already have the COVID-19 disease as a preventative measure or a treatment measure. Unfortunately, despite of all these evidence and studies supporting that vitamin D supplementation could be helpful as a treatment measure and preventative measure in COVID-19 infection, there is no clear recommendations from World Health Organization or Ministry of Health, even though we all know that a big part of the population have vitamin D deficiency. Therefore, since I believe we all responsible for our own health and well-being, we should all do vitamin D or D3 supplementation according to the studies that we mentioned in this video, especially whoever is at risk or patients COVID-19 infection, to speed up the recovery process and also to prevent from lingering symptoms such as fatigue, which is one of the most common symptoms post COVID-19 infection. Hope you enjoyed this video, and if you like this video and find it beneficial, please share it in your social media and to your friend and families. And like always, stay happy and healthy. Thanks and have a great day.